Next is about dundubhisvaniya kalpam vyakhyasyaamah ithva bhagavan dhanantarihi. Now, this chapter is comparatively less significant from the current point of view. The basic the issue is dundubhisvaniya is a technique of administering the drugs into the environment by beating the drums. Dundubhi, the drums, and the swara, the voice, the noise produced by the drum is used for administration of the drug. And certain of the yogas are mentioned here, and those yogas are Dhava, Ashwakarna, Shirisha, Tinisha, Palasha, Pijumarda, Patali, Paribhadraka, Amra, Udumbara, Karahata, Arjuna, Kakubha, Sarjaka, Pita, Sarjaka, Kapitana, Shleshmataka, Ankotha, Amalaka, Pragraha, Kutaja, Shami, Kapitha, Ashmantaka, Arka, Chirabilva, Mahavruksha, Arushkara, Aralu, Madhuka, Madhushigru, Shaka, Goji, Murva, Bhurja, Tilvaka, Ikshuraka, Gopagonta, Arimedanam, Bhasmani Ahritya, Gava Mutrena, Ksarakalpena, Pariswavya Vipacheta, Tadyachatra, Pitpadi Mula Tanduliyaka, Tanduliyaka, Varanga, Chocha, Manjishta, Karanjika, Hastipippali, Maricha, Vidanga, Grihadhumana, Dhuman, Dhuma Ananta, Soma, Sarala, Bahlika, Guha, Koshamra, Shvetasarshapa, Varuna, Lavana, Plaksha, Nichulaka, Vanjula, Vakrala. Yeah, that's Vakrala, Vardhamana, Putrashreni, Saptaparna, Tuntuka, Yelavaluka, Naga, Danti, Ativisha, Abhaya, Bhadradaru, Kusta, Haridra, Vachachurnani, Loha Namcha Samabhagani, Tatakshara Agatapakam Avtarya, Loha Kumbhe Nirudyata, Anena Dundubhim Limpeta, Padakam Toranaja, Shranata, Darshanata, Sparshata, Bishap Samprati Muchere. Esha Ksharagadavu Nama, Sharkarashu, Asmarishja, Arshassu Vatagulmeshu, Kasashula, Udareshuja, Ajirne, Grahani Doshe, Bhakta Dveshe Chadarone, Shophe, Sarvasare Chapi, Deyashwase Chadarone, Tada, Sarvavisharthanam, Sarvathivo Vejade, Etat Takshakam Khyanam Darpang Kurusha, Darpankusho Agadaha. Ksharagada is one of the yoga where you have large number of drugs to be added. It should be prepared in the form of a kshara and applied over the drum as such, and or maybe the flax, or maybe the welcome hordes. It has to be applied, and by the spraying of fine particles, it can result in prevention of any sort of the poisons, as well as Sushil says it can cure the conditions, or it can reduce the possibility of a poison contamination even by the hearing the sound or of that drum, or by looking at it, or by touching, by physical contact, any of that. It's a very potent agada as such, and it's also used in other diseases like Arshas, Vatagulma, Kasashula, etc. Then Vidanga Triphala Danti, Bhadradaru, Hare Namaha, Talisha Patramanjistha, Keshara, Utpala Padmakam, Dadimam, Marati Pushum, Rajanyam, Sarivestere, Priyanguhu, Tagura, Tagaram, Kushtam, Bruhatyocha, Yelavalukam, Sajandana, Gavakshi Bihi, Yetehi, Siddham Vishapaham, Sarpik Kalyanakam, Yetate, Graha Apasmaranashanam, Pandu, Amaya, Gara, Shwasa, Mandani, Jarakasanatu, Shoshanam, Alpashukranam, Vandhyanam, Chaprashasre, Kalyanaka Ghrita is the other yoga. Now again, Kalyanaka Ghrita, in that name you get the product in the market now, but that yoga is slightly different from the yoga mentioned in Sushruta. Kalyanaka Ghrita, the market available Kalyanaka Ghrita is from the Vaishyajaratnavali yoga, where you have some more of the drugs added. But anyway, one of the yoga which is considered as Vishapaha, Vishagna, and or it's also used for Apasmara, Pandu, etc. other diseases. One of the yoga which could be considered as a Vishagna. Then Apamargasya Bijani Shirishasya Mashakana Shwete Dve Kakamachincha Gavam Mutrena Pesheta Sarpihi Ete Susamsiddham Visha Samshamanam Param Amrutam Nama Vikyatam Abhi Sanjivayet Mrutam. Another Amrita Ghrita, where Apamarga Bija and Kakamachi etc. are added, and that's also called as a the Amritaghata. Chandana Aguruni Kushtam Tagaram Tilaparnikam Prapondarikam Naladam Saralam Devadaraja Bhadrashyam Yavapalam Bhargi Nilim Sugandikam Kalekam Padmakancha Madhum Nagaram Jatam Punnaga Ela Valuni Gaikam Dhyamkam Balam Toyam Sarjarasam Mamsim Shatapushpam Remukan Kalishapatram Kshutrilam Priyangum Sakatanatam Shilapushpam Sashailayam Patram Kalanasarivam Katutrikam Shidashivam Kashmatiyam Katarohinim Somarajim Ativisham Prithvikam Indravarunim Ushiram Varunam Musam Kustumburu Nakham Tata Shwete Haridre Sthoneyam Laksham Chalavananica Kumudotpalapatmani Pushpam Chapitra Arkajam Champaka Ashoka Sumanaha Tilvaka Prasavanica Patali Sharmali Shailu Shirishanam Tadaivaja Kusumam Trinamulyascha Surabhi Sindhu Arajam Dhava Ashwakarna Parthanam Pushpani Tinishasya Gugulum Kunkumum Bimbim Sarpakshim Gandhanakurim Yedat Samritya Sambharam Sukshma Surya Churnanikarayeta Gopikta Madhusarpir Yuktam Shungen Dhapetam Bhagnaskandam Vivrataksham Mrityoho Dashtantaram Gadam Anena Agadam Kshena Manushyam Punarahareta Esho Agnikalpam Duruvaram Kshutrasya Amitadejasah Visham Nagapatehanyata Prasabham Vasukerapi Mahasugandinama Ayam Panchashiti Angasanyutaha Raja Agadanam Sarvesham Rajno Haste Bhavet Sada Snaka Anuviktastu Nrupo Bhavet Sarvajana Priyaha Rajishtunam Charabhate Shatumadhyagatopi Saha, another Mahasugandhi Agada, where 85 substances are added. The drugs which are added are totally come to 85, and that 85 substances they are prepared and then kept in a shrunga, that horn of an animal, and then once it has prepared well, it can be used in many diseases. It can be used in the fractures, or even in the patients who have become unconscious. It can be used, and Sushil says it can reduce or neutralize the poisonous effect of even Vasuki, that most potent snake acid, and it's to be used for kings and king-like persons because it is a costly preparation. Ustavarjo Vizikarya Vishartanam Janatah Muktva Kitavisham Tadhi Shitena Abhipravartate. In all the conditions of Visha except the Kitavish, insect bites, it will be discussed in the next chapter. Other than that, in all the conditions, Shita Karya, the patient has to be exposed to the cold, should not be warm. Only in the Kitavisha, insect bites, cold exposure should be avoided. That part, insect bites and their complications, we will be discussing in the coming chapter, Kitavisha. Annapana Vidhuktam Upadharya Shubhashubham Shubham Deyam Vishartebhya Viruddhyabhyascha Varayat Phanitam Shikrusaviram Adirna Adhyashanam Tata Vartayetta Samasena Namadhanyadikam Ganam Divaswapnam Vyavayancha Vyayamam Krodhamatapam Sura Tila Kulatham Shavardhayedhi Vishataraha. In all patients who have that poisonous bite, you have to take care in the food. The food should be nourishing food, and there should not be any viruddhahara, and food which has a pungent taste or alcoholic beverages, they should be avoided. And namadhanya, that which is heavy for digestion, also has to be avoided. Sleeping during the daytime, sexual activity, any rigorous physical activity, emotional disturbances also have to be avoided. Prasanna dosham prakristam dhatum annabhikamsham samamutra jihvam prasanna varnyende chittayasham vaidyo avagached abhisham manushyam. The signs of recovery from the poisonous bite is when the patient has all the normal dosha dhatus and has a good appetite and proper evacuation of the bowel and urine bladders as such, and has to have a pleasant mind set as such, then you consider that the patient is normal. That's about one chapter. Iti Sushil Samhitayam Kalpasthane dundubhisvaniya kalpo nama shashtodhyaya. From the practical point of view, this chapter has a relatively lesser relevance except for some of the yogas of Agada which could be prepared. So we will go into the next chapter. Athato mushikakalpam vyakhyasyaamyaha yathavacha bhagavan dhanvantirihi. Now another of the controversial chapter. Sushila says the mushikas, rats, are poisonous, and the poisonous are semen is considered to be poisonous. It's not the rat bite. Purvam Shukravishaha Uktaha Mushikakalp Samasataha Nama Lakshana Bheshajyehi Ashtadasha Nibodhame. Sushruta describes 18 varieties of the rats as such. Now, actually, from the biology point of view, there are around 3,000 species of the rats throughout the world, and to identify these rats would be quite difficult. And those are, according to Sushruta, Lalanaha, Putrakaha, Krishno, Hamsihi, Chikkiraha, Chichundaraha, Alasaschaiva, Kashaya Dashano Apija, Kulingashcha, Aditaschaiva, Chapalaha Kapilastada, Kokilo Arunasanjashcha, Maha Krishnaha Tatha Induraha, Shvetena Mahata Sardhan Kapilena Akhuna Tada, Mushikashcha Kapotabha Tateva Astarasha Smutaha. The 18 varieties of the rats are described and their names. To practically identify them as biologically, these species is a practically difficult job. I don't know, I am not able to make out. Maybe some research is needed in that area. Shukram pradati yatraisham shukras prashtehi sprishantiva nakadantabhistasmin gatre raktam pradushyati. Now, when the semen of these are discharged anywhere and the person who comes into contact with that body fluid, semen, or it could be due to the bite with the contaminated semen, the person, human beings may have dushti, rakta dushti. Now, from the biology point of view, the rats are classified as genus Rattus, and the most common rat in India is Rattus norvegicus. Norvegicus is the most common household rat. Some of the specific rat species which are commonly seen in India, they are mentioned here, but again, as I told you, to correlate them with whatever Sushruta has mentioned and to identify practically is difficult as such. Now, there are two important conditions. From the current point of view, we know that rats are not poisonous, but patients or human beings who come into the rats, they can have the diseases. Among them, the rat bite fever, that is streptobacillosis, and leptospirosis are the two important conditions where the disease is named with the rats as such. Now, the streptobacillosis is actually caused by Spirillum minus or Streptobacillus maniliformis, which are considered to be in the normal oral flora of the rodents. And any person who comes into contact with the rat's secretions, mucus secretions, mucins as such, it can produce a symptoms, and the typical symptoms are fever, polyarthritis, rigors, which resembles any other viral fever like or bacterial fever like conditions. Something like chikungunya or dengue like presentations would occur. Fever lasts longer period, and for many times it can continue for months together, and fever may have waxing and waning character, but ultimately it results in involvement of the joints. Painful swelling joints would occur, and as the condition progresses, patient may have severe polyarthralgia and myalgia. Severe pain in the joints would be the major clinical symptoms. Both large and small joints are involved, and most patients experience inflammation in the knee and ankle joints at some point during the illness. Comparatively, in India, streptobacillosis is less common, whereas it's more common in eastern countries like Japan, China, etc. Whereas in India, we come across quite frequently the leptospirosis, another of the disease, which is related to the rat. Now, most of the nomenclature of rat bite fever in India applies to leptospirosis, but from the global point of view, rat bite fever refers to streptobacillosis. There's a bit of confusion about that. Now, with the leptospirosis, it occurs due to contact with the urine or other body fluids except saliva from the infected animals, and it's not only the rats which are the carriers. Many other animals, they are known to produce this spread of leptospirosis. Contact with water, soil or food contaminated with the urine of infected animals would occur, and leptospirosis is mainly presented in two phases. First phase is fever, chills, headache, muscle ache, as usual any other fever like conditions. But the second phase is when the patient has a kidney or liver failure or even meningitis, and this is a dangerous condition. A few years back, we had an epidemic of leptospirosis in our area, in Udupi also, in our district, and it tends to present as an endemic area. Like in some seasons, the leptospirosis would occur at some areas, and then again it subsides. From last 1 year, we didn't have many cases of leptospirosis. Some 2 or 3 years back, we had lots of cases of leptospirosis as such. So that's what we consider as the rat fever now. In addition to that, another of the diseases which is always related to the rats is the plague. Plague, of course, it occurs due to the contamination with the organisms which live on the rat body. So rats act as a medium of spread as such. And whenever there is an eruption of the plague, usually the target would be to kill the rats. That's what usually happens. But that again, it's not really a disease produced due to the poisonous effect of the rat. So when Sushil says rats being poisonous, we need to have a clear idea, like it's not that the rats have a poisonous organ, and whether it is really the semen or other body secretions which produce the symptoms of transmitted diseases. So are rats acting as a vector in case of the plague? Now these facts have to be understood properly and should be seen in the light of what Sushil has considered as the poison of the rat. Now the clinical symptoms of the rat mushikakalp jayante granthaya shopaha karnikaha mandalancha pidaka upajayascha ugra visarpaha kitibhanicha parvabhedo rajastivro murcha angasadanam jwaraha daurbolya mruchishwaso vamathu lomaharshanam dasharupam samasottam etad vyasam atashram. This is exactly the clinical feature of the streptobacillosis. Lala sravah lalanena hikha chardishjayate dundubhisvaniya tu lishyat tatra samakshikam. Now in such conditions, the typical patients of rat bite according to Sushila, that's exactly this streptobacillosis symptoms, where the patient would have a initial swelling and there would be eruptions over there, and it involves the joints, and there could be severe pain in the joints, impairment of the movements would occur, even unconsciousness can occur. These are the clinical signs. So exactly the streptobacillosis is described as the mushikakalp, and in such conditions, of course, the other later conditions, it can result in lalasrava halalena hikka chardishjayate. It can produce discharges, salivation, or even hiccup and chardi. One of the best immediate first aid treatment according to Sushila is dundubhisvaniya. Dundubhisvaniya is one of the siddhanya, that millet, which has to be prepared with the makshika, madhu, and it has to be taken in. Putrakena angasarascha panduvarnasjayate chiyate grantibhischa angam akushavakasanibehi shirisha ingudakalkam tulishat tatra samakshikam. Now Sushila gives the detailed description of the clinical symptoms and variation according to the types of the rats which were mentioned at that time. Again, practically it's quite difficult to make out like whether this is seen or not. Now Putraka variety of the rat, when it produces the diseases, it produces angasada, panduvar, patient becomes paler, and the granthi swellings will be quite huge, and swellings may look like, have a shape of the rat's like. And in such conditions, Shirisha and Ingudakalka has to be given. Then Krishnena, with the Krishna rat, Damshe Shofo, Asrukchardihi, Prayascha Durdine, Shirisha Palapusam to Vivek Mushikakalp. In such conditions, where the Krishna rat variety would produce, there would be lot of swelling, and there could be hemoptysis, and very often occurs in cloudy days. This aggravates in cloudy days, and the treatment there is Shirisha Pala Kushta, this with the Kimshuka Bhasma, Kshara has to be given. Hamsirena Anna Vidvesha Jimbha Romram Jaharshanam, Vived Arabodha Suvantaha Tatramanavaha. With the Hamsira variety of the rat, the patient would have dyspepsia, yawning, and romaharsha, the erection of the pili. And in such conditions, Aragodhadi Kashaya with the Vamana, patient has to be having Vamana as such. Chikkirena, with the chikkira variety of the rat, Shiro Dukkam Shofo Hikka Mumistadha, Jalini Madana Ankota Kashayi Vametam, Yava Nala Rishabha Kshiram Brihatyoshtatra Lapeta. The clinical symptoms of chikkira rat bite. Of course, all these are now practically very difficult to make out because we do not know which are the species. Chichundarena, Tit Chardijwaraha, Durbalyameva, Grivasambha, Prishashova, Gandharjanam, Vishuchika, Chavyam, Haritaki, Shunki, Vidangam, Pipari, Madhu, Ankota Bijam, Tatha Pibeta, Atra Vishapaham. In the Chichundara Visha rat, it produces Chardi, Jwara, Durbalya, and Grivasambha. Practical is swelling in the back, impaired sensation of the smell. In such conditions, Chabya Haritaki Shunti has to be given. Grivasambho Alasena, with the Alasa variety of the rat, it produces Grivasamba, Urdhvavayu, Damshe, Rujajwaraha, Mahagadam, Sasarpishkam, Dishyatra Samakshikam. In that condition, Mahagada has to be there. Then Nidra Kashayadantena, with the Kashayadanta variety of the rat, it will be producing some excess of somnolence, sleep, excess of sleep. Nidra Kashayadantena, Hritshosha, Kashamevata, Kshaudropeta, Shirisha Silishat, Sarapala. In such conditions, Shirisha Sarapala has to be given. Kulingena, with the Kulinga rat, Rujaha, Shofo, Rajeshcha Damshamandale, Sahe, Sasindhuare, Jalishat, Tatra Samakshike. In such, there would be Kulinga rat would produce swelling and cracks over the surface of the area. In such conditions, Sindhuhara has to be given. Ajitena, with the Ajita rat, Angakrishnatum, Chardihi, Murcha, Graha, Snuk, Kshirapistam, Palindim, Manjistam, Madhunaliheta. Ajita rat would produce a blackish discoloration, vomiting, unconsciousness, and Sugraha, cardiac pathology. In such conditions, Snuhi Kshira has to be given. Chapalena Bhavit Chardi, Murcha, Sahasasnaya. Shaudrena Tipalam Vishatam, Bhadra Kasta Jatanvitam. With the Chapala rat, there could be Chardi Murcha as such, and treatment has a Shaudra with Tripala and Bhadra Kasta Jata. Kapilena Brane Kotha, Joro Granthagamas Satrada, Lishat, Madhuram, Shwetam, Tapipunaruam. With the Kapila variety of the rat, there could be decaying in the wound and Jwaraha, Granthi, etc. And in such conditions, Shetapunarnama has to be given. Grantaha, Kokilena, Ugraha, Jwaro, Dahashtadarana, Varsha, Bhu, Niline, Kwaka, Karka, Siddham, Gazam, Viveda. In the Kokila variety of the rat, there could be Granthi, Jwara, Daha. Arunena, Anila Krudho, Vatajan, Kurtegana, Mahakristena, Piktam, Shvetena, Kapevaja, Mahata, Kapilena, Asraka, Kapotena, Chatushtayam, Bhavanti Chesham, Damsheshu, Granthi Mandala Karnikaha, Pitaka, Upajeshtu, Graha, Shopashta, Vishadaruna, Dhazikshira, Gazaprastraha, Traya, Prateka Shomadaha, Karanja, Arabuda, Biosha, Bhati, Amshumati, Siraha, Nishpatya Chesham, Patasya, Chaturtho, Amsha Punar Bhaveta. Trivirtu Goji, Amrita, Vukta, Sarpagandaha, Samritikaha, Kapita, Dadimatvokacha, Shlakshana Pishtaha Pratapetu, Tatsavam Ekata Krutva, Shanihi Mudvagnina Pacheta, Panchanam, Arunadina, Mushameta, Vepohati, Kakadinin, Kakamatyo, Suraseshu, Athava Katam, Sirascha Shavit Prapta Kuryab, Samshodhanancha, Aruna, Mahakrishna, Mahata, Kapila, these varieties of the rats, they produce symptoms like Granthi Mandala, the swelling, and the Pitakopajeha eruptions would be more, swelling would occur very rapidly, and the yoga which is mentioned here are the specific yoga where you prepare with the Dazik, Shiragusa, etc. and Kakadani, Kakamachal you have to put in, and then Sira Vyatha also is suggested. So one of the specific yoga mentioned for these four varieties of the rat poisoning is mentioned. Sarvesham Chibikaryo Mushikanam Visheshwayam Dagdha Vishnaved Damsham Prachitam Pralepeda Shirisha Rajani Kusta Kunkumehi Amrita Yatehi. The rat bites, according to Susri, in all the conditions, the Raktamokshan is indicated and Prachana has to be done, and over the area, Lepa has to be applied with the Shirisha, Rajani, Kusta, etc. Chardanam Chalini Kwatehi, Shukhakhya Ankothai Orapi. The Vamana with Jalini Kwata also is suggested as another remedy. Shukakhya Koshapatyosha Mulam Madana Evacha Devadali Phalam Deva Cheva Dagdha Pitva Visham Mameta सर्वमूषिकदष्टानां एष योगसुखावः फलं वचा दैवदाली कुष्ठं गोमूत्रपेषितं पूर्वकल्पेन योज्या स्युः सर्व उन्दरविषच्छदः. Another of yoga which can be used for all rat poisonous conditions, the yoga which could be prepared as such. Then Virechane Trivardanti Triphala Kalka Ishade. For the Virechana, Trivardanti Triphala Kalka are recommended for rat poisoning. Then Shiro Virechana is another of the option of the treatment if the patient becomes semi-conscious or unconscious. In such conditions, Saraha Shirishashapalanja Hitah Trikotukadhyascha Gomaya Saraso Anjane Kapitta Gomaya Raso Lishat Makshika Sanyudam Rasanjana Haridra Indra Yava Katvishu Vakadam Pratas Sativisham Kalkam Lishat Makshika Sanyudam Kanduliyakam Muleshu Sarpi Siddham Vivenaraha Aspota Mula Siddhamma Panchakapidhamevaja Mushikakalp Vishaprayah Kupyati Abhreshu Aneshrudam Tatrapi Esha Vikaryo Esha Dushi Vishapaha. Now, in the Shiro Virechana Yoga is mentioned where you prepare the drug with these drug contents, and if the patient has given even a leha with the mushikakalp, which can be liquid in, or in general, all the mushika vishas, they get aggravated in cloudy weather, and such aggravations which occur after the bite, long time bite. In the cloudy weather, the symptoms increase. The treatment of Dushi Visha has to be followed. Stiranam Rajatam Api Vrananam Karnikam Bhishika Patayitva Yathadosham Ranamat Chapishodhayat. If there is a granuloma formation at the site of bite by the rats, then that, and it remains chronic, hardened, then it has to be excised. It has to be opened and then excised, treat it as a wound. So a granuloma formation of a rodent bite is a common complication which occurs where there could be some foreign bodies left over. Very often a small piece of the tooth also may be left over. In such conditions, you will have to treat that. Then the next part is Shwashrugala Tarakshu Ruksha Vyaghraginam Yada Anilaha Shleshma Pradushto Mushnati Sanyamahashrigaha Tada Prasasta Langula Hanuskandho Ati Lalavan अत्यर्थ बधिरो अंधश्च सो अन्योन्यम अभिगावति तेन उन्मत्तेन दष्टस्य दंष्ट्रिणां सविषेण तु सुप्तता जायते दंशे कृष्टं चाति श्रवत्यसृक् दिग्धविद्धस्य लिंगेन प्रायश्च उपलक्षितः. The complications can occur due to the bites by other animals also, the other animals like dogs or maybe foxes, etc. Then it also could be due to the flatus of these animals also can produce the complications according to Sushruta, and it produces a kapha vitiation, and the patient may become have impaired sensations like the vision may be impaired, hearing sensation could be impaired, and the patient may have excess of salivation. These are and the patient even may have unconsciousness also. These are the clinical symptoms of the viral induced pathologies. And most of the times these symptoms related to the rabies. So Sushruta describes about the rabies symptoms here actually, where the sensations could be impaired and there could be excessive salivation, convulsive disorders could occur, and such conditions Sushruta has said it has to be as if the patient would have a serious complications as such. येन चापि भवेत् तस्य चेष्टामृतं नरः बहुशः प्रतिकुर्वाणः क्रियाहीनो विनश्यति. In all these conditions where there is a bite by any animals or maybe that symptoms of contamination would occur, you have to treat according to the symptoms as such presented, and dosha has to be assessed and specific dosha treatment has to be considered. Damstrina yena dashtascha tadrupam yastu pashyati apsua yadiva adarshe arishtam tasya vinirdisheta. In all such rabies-like conditions, rabies which could be transmitted due to the bite by many animals, dog is one very common medium. In such conditions, If the patient is having the illusion of seeing that specific type of animal which has bitten him, or he sees the shapes of that animal, it's considered as arista lakshana, then the patient is outcome would be poor. Then trasyati akasmadyo abhikshnam drashva sprashvapi vajalam jalatrasam tam vidyat rishtam tadapi kirtitam. Jalatrasa, the phobia of water, that's one of the major clinical symptoms of the rabies. Patient would not have hydrophobia is the other usual word used. Jalatrasa is the word used by Sushila. If the patient has that kind of a sensation, that's because of the impaired neurological conditions, and the patient is not able to swallow water. Water will get into the respiratory tract, and hence the patient will have an impression that produces a spasm also, and hence the patient would have the hydrophobia. And in that condition, if the patient has that symptom, that's considered as incurable. Even without bite, a obvious history of bite, a jalatrasa can occur. Adasto va jalatrasi nakasanjana siddhyati prasutto atha uttito vapi swastha trasto na siddhyati. Now, if the patient has a jalatrasa, that's hydrophobia, even with the history of fever, Sushruta says that condition is incurable. And if the patient is not, even after making him sleep, he cannot sleep, there is a spasm and the patient tends to get up, that's again the signs of the spasm. That also is a poor prognosis. It cannot get cured. Damsham visravya stai dasyahi sarpisha paridahitam pradeshyad agadi sarpihi puranam payetaja arka kshira idam hyasya dadyat chapu vishodhanam shvetam punarnam chasya dadyat uttara dattura kayitam palalam tilatailam jarupikaya payogudah nihanti visham alarkam meghavrindam vivanelaha. For the alarka visha, that's the rabies-like symptoms, Sushruta says that treatment is a Raktamokshana has to be done, and the area has to be cauterized by ghee, heated ghee. Then agada has to be applied over the area. Purana Ghrita has to be given. Arka Kshira has to be given for Shodhana, Virechana. And Shvetapunarnama Dhattura have to be given, and these are considered to be treatment for the rabies. Of course, now present day situation, rabies is considered to be one of the critical condition, and the treatment is anti-rabies vaccine, which it makes outcome significantly different. Otherwise, there is no other curative treatment for the rabies as such now. मूलस्य शरपुंखायाः कृशं धत्तूरकार्दिकं तण्डूल उदकम् आदाय पेशयत् तण्डुलैः सह उन्मतकस्य पत्रैः तो सम्यश्च आपूपकं पचेत् खदेत् औषधकाले तम् अलर्कविषदूषितः करोति श्वविकारांस्तु तस्मिन् धीर्यते औषधे विकाराः शिशिरे याप्याः गृहे वायुविवर्जिते ततः शान्तिविकारस्तु स्नात्वा तैव अपरे हनि शालिषष्टिकयोः भक्तं क्षीरेण उष्णेन पूजयेत् दिनत्रये पञ्चमे वा द्विजिरेषु अर्धमात्रया कर्तव्यो भिषज अवश्यम अलर्कविषनाशनः कुप्येत् स्वयं विषं यस्य न स जीवति मानवः तस्मात् प्रकोपयेदाशु स्वयं यावत् प्रकुप्यति. Now, another of the yoga which is mentioned for the alarkavisha, that's the rabies-like conditions. Unmataka Dattura Patra, prepare with that rice preparation, and the patient has to consume that. See, Dattura is a poison by itself, and that poison is administered. And Sushil says, after giving this drug, patient may behave like a dog as such after consumption, and the patient has to be nursed in a cold room without water, where there should be no exposure to the water, and only after the patient recovers after a behavior of the dogs, then the patient has to be given this rehabilitation treatment like a bath, and then light food has to be given, and this is one of the protocol of the treatment. Then Bijaratna Ushadi Garbehi Kumbehi Shitam Puritehi Snapayattam Nadi Tire Samantrehi Vatishpade Balim Nimedya Tatrapi Punyakam Palalam Dadi Malyani Chabitrani Mamsam Pakwamakam Tata Alakadhipate Eksha Sarame Ganadhipa Alarka Jusam Etan Me Nirvisham Kurmachirata. Now, the further Bali also has to be given. Patient has to be bathed in a river, and Bali has to be given with the mantra. Mantra also is mentioned as one of the remedies. Dadyat samshodhanam tikshnam evam snatasya dehina ashuddhasya surudhipi vrane kupyate tad visham. After this, patient has to be given shodhana chikitsa, because without shodhana there could be complications of chronic wound conditions. श्वादयो अभीताः व्यालाः ये अत्र दंष्टाविषामताः अतः करोति दष्टस्तु तेषां चेष्टं मृतं नरः बहुशः प्रतिकुर्वाणो न चिरात् मीयते च सः. The dogs and other animals are considered damshavisha, and hence when they bite, that they produce symptoms. So early intervention can cure the condition. If there is a delay in the intervention, that can make a poor prognosis. नखदन्तक्षतं व्यालैः यत्कृतं तद्विमर्देत सिञ्चेत् तैलेन कोष्णेन हि ते हि वातप्रकोपकाः. If there is a bite, injury by the nails of the animals, different animals, in such conditions, immediately, if it is a simple superficial ablation, it has to be cleaned with the warm taila, warm oil, because they are known to produce vitiation of vata. With this, we conclude the chapter of mushikakalp. Practically, this chapter has a lesser relevance. Even that rabies treatment mentioned by Sushruta in that context, in the present day situation, it has a very little relevance in the present day situation. With this, we will conclude today, and we will deal with the last chapter of the Kalpasthana in the next, and then close the Kalpasthana. If there are no questions, we will wind up. If there is some, is there any question like? Right, okay, no.